Okay guys, you've been diagnosed with hip bursitis, rats, right? And you're not really sure what it is. So let's sit down and talk about it. So here's your bursa, guys. That is your trochanteric bursa. That's the one I'm going to be talking about today because that's one of the most common ones that I know of that can be irritated and result in hip bursitis. The bursa is a fluid-filled sac that helps to mitigate abrasion between muscles or connective tissue and bones. So that bursa really just acts as an attenuator and a friction-free surface between two interfacing tissues. Now, fun fact, did you know there are at least 8 bursa in the hip? There are a lot of bursa. So you might want to know exactly the location of your pain, and that might tell us a little bit more information as to what type of bursitis it is. Again, for this little informative video, we're going to be sticking to the trochanteric bursa, but there are 8, at least that I know of, that are in the hip that could be playing a role in causing your pain. So what's causing it, and what can we do about it? So what I know of and what I realize is that the glute med, some of these powerful hip abductors, they get weak. Okay, so there's a great example of the glute medius right there. It attaches to the greater trochanter, and that's right where our bursa is. When that muscle gets weak, it doesn't quite do its job like it needs to. And let me show you this motion real quick. So the gluteus medius is a key player in hip abduction. When that muscle gets weak, all of a sudden it's not controlling that joint like it needs to. When it doesn't control the joint like it needs to, all of a sudden that trochanteric bursa starts to take more load. When it starts to take more load, it doesn't get happy about that. It wants the muscles to do their work so that it can do its work of just keeping everyone happy and being that fluid-filled sac. So how do we help you? It usually starts out with, and in the case of if you're inflamed and irritated, getting our hands on it, loosening up the tissue, getting some blood flow in there. After we've done that, it's really important that we start to strengthen your hip muscles again. So gluteus medius is one that get to know of if you've had or dealt with trochanteric bursitis, because it's a muscle that we're going to need to strengthen. In addition to glute max, and in addition to some muscles around it, of course. But that gluteus medius is one of the key muscles that I've learned to help out with my clients with trochanteric bursitis. Okay guys, as always, thanks for tuning in.